Are you aware that 80% of women will develop fibroid at one point in their life? Do you know that as a black woman, you are at more risk of having fibroid compared to your white counterparts? Well, this information is not to scare you, but to inform you. Hello guys, you're welcome to my YouTube channel. It's me, your girl, Nurse Peace Chueze. I'm a Nigerian trained nurse and midwife who currently practices as a registered nurse here in the NHS England. Today, I'm going to be talking all about fibroids and telling you what the cause of fibroid is, its symptoms, complications, treatment, which is also known as the management. Fibroid simply means non-cancerous tumors which grow in the uterus. These fibroids are known to grow in various sizes. Now, in talking about these fibroids, it has been noted that many women actually who have fibroid do not get to know about it because they do not experience the symptoms. So let's go ahead to find out what the cause of fibroid is. It might surprise you to know that there is no known cause for fibroids. However, there are what we call predisposing factors. So predisposing factors simply means what puts a person at more risk of developing fibroids. These predisposing factors, I'm going to be just discussing a few of them. One of them is having a family history of fibroid. It simply means that someone in your family have had fibroid in the past, possibly your mom or your sister. So if you have such a relative, it is likely that you are also going to have fibroids. Then the next predisposing factor is obesity. This is also followed by another predisposing factor for fibroid, early menarche. For instance, a girl child who starts menstruating at the age of 8 is at more risk of developing fibroid compared to her counterpart who starts menstruating at the age of 12. This also helps us to understand the reason why we said that the exposure to estrogen actually aids the growth of fibroids. This is because a girl child who starts menstruating automatically begins to have exposure to estrogen. So this is what explains why early menarche predisposes one to developing fibroids. Then another is late menopause. That is when a woman experiences her menopause at a later age in life, because normally women experience menopause between the ages of 50 to 55. But if at any point in time the woman experiences her menopause at a later age in life, possibly let's say 60 or above that, it can be termed as late menopause. Then another thing is hormone. The hormone known as estrogen has been found to greatly support the growth of fibroids, and that helps us to understand the fact why early menarche can predispose a person to fibroid. For instance, a girl child who starts menstruating at the age of 8 is at more risk of developing fibroid compared to her counterpart who starts menstruating at the age of 12. This also helps us to understand the reason why we said that the exposure to estrogen actually aids the growth of fibroids. A girl child who starts menstruating automatically begins to have exposure to estrogen. So this is what explains why early menarche predisposes one to developing fibroids. So these are the risk factors for fibroid. Now, let's go ahead to talk about the symptoms of fibroid. So having these symptoms does not necessarily mean you will have fibroid, but it helps you to know that you might possibly have it. One of the major symptoms which a lot of women are quite worried about is heavy bleeding. Such women experience serious blood loss during their monthly period, and this predisposes them to anemia. The next on the list is bleeding in between periods. So you see that such women, even after their period, maybe a week or so, they still begin to see another form of bleeding. Next is painful menstruation. So such women experience serious pain during their period, and such pain can even make it difficult for them to engage in their activities of daily living. Sometimes they are not even able to go to work, school, or even attend very important occasions. And then sometimes such women experience constipation and very serious pain. Now, we are going to be talking about the treatment of fibroids in terms of the use of medication and also the surgical management. In the use of medications, you find out that most times the healthcare provider uses the oral contraceptive pills to manage one of the symptoms. In fact, when we talk about the use of medication, they do not necessarily remove the fibroids, but they help to manage the symptoms. So depending on the symptoms you come up with, your healthcare provider or your doctor might prescribe oral contraceptive pills, and this helps to manage the bleeding. They can also prescribe non-steroidal anti-inflammatory drugs. So this helps to manage the pain. But women who are pregnant and who have fibroids, in fact, they are not usually given ibuprofen, because it's been found out that it affects the baby's circulation, especially if the woman is up to 20 weeks gestation. Then, when we talk about the surgical management of fibroids, we are talking about the use of surgery to manage fibroids. One of the very important surgical intervention is the use of myomectomy. In this situation, a trained surgeon simply takes the woman to theater and takes out the fibroid. In this case, the woman's womb, known as the uterus, remains intact. We also have the uterine arterial embolization. This simply means the blockage of those arteries which supply the uterus where these fibroids grow. So when the blood supply to these arteries are cut off, you find out that these fibroids stop growing, and thus those symptoms the woman used to experience will no longer be there. Another surgical intervention, which is usually the last resort, is known as hysterectomy. Hysterectomy simply means the surgical removal of the uterus. Now, in this situation, the woman's womb is removed entirely, and this means the fibroid also goes with it, and it is usually the last intervention, which most healthcare provider will not give you immediately you present with those symptoms, unless every other method has failed. Now, that is all for today. If you have any questions about fibroids, please leave them for me in the comment section and I'll be happy to answer them. However, there has been so many things people talk about fibroids, which is not true. I would like you to tell me any of them you know down there in the comment section. And in my next video, I'm going to be discussing them with you, and I'm going to be debunking them and telling you why they are not true. This is very important. Why you should know them is because the various things that people talk about fibroids are such that when people hear it, they feel that there is no way they can get help. But getting to know all about this will help you to see reasons why you should seek intervention. But before we go, I would also like to tell you the complications of fibroid if they are not treated. Now, one of the complications of fibroid is infertility. Yes, but it might interest you to know that not every woman who has fibroid will become infertile. This has to do with the location of the fibroids. The next complication is postpartum hemorrhage. Postpartum hemorrhage simply means excessive blood loss after childbirth. But in women who do not have any symptoms of fibroid, even though they have fibroid, most times they do not have postpartum hemorrhage. So that is not to scare you, but to inform you. Another complication of fibroid is miscarriage. So it also has to do with the effect that this fibroid has had on the uterus. So these are the complications that are very common in women who have fibroids. So If this has really been of interest to you, please do not forget to like, share, and subscribe to my channel. I'm so happy that you've stuck with me to the end of this video. Thank you for watching, and I'll see you in my next video. For now, bye.